Okay, cool. We're working. So 2 o'clock, day 2 of our Directors of Training seminar. I appreciate everybody coming back and being with us. Had a really good day yesterday. I was kind of expecting some sort of a technology glitch or something, but it went surprisingly well. I think the presenters did a great job. I learned some things that I didn't know. I'm pretty up to date on that stuff, but there was some stuff that I picked up from it as well. Anything anybody took away in particular? Anything that resonated with you? Anything coming out of yesterday that anyone wants to talk about before we get started? Okay, it doesn't sound like it. Everybody got the 10 steps to implementing a program, right? We all have that, working that or getting ready to work that. Okay, so I don't know who am I turning it over to. Ken, am I turning it over to you guys first, or we turn it over to CPWR first for our
CPWR first, Anton.
Okay, thank you. I appreciate it. So we'll get started. We'll save some time in the at the end so that we can talk about whatever issues you guys would like to. Again, it can be on topic, it can be off topic, and again, it looks like George, you didn't receive the 10 steps. I will make sure that gets emailed out to you. Thanks for putting that in the chat. And just a reminder for anybody, if you want to communicate during the presentation, you have questions, feel free to put it in the chat box. You can use the raise hand feature. We got a couple people watching, if you want to make a comment or ask a question. So I will turn it over to CPWR, Gary or Chris, if you guys want to unmute yourself and go ahead and pick up and start. I appreciate it.
Hi, thank you. I'm Chris Kane. I am the Executive Director of CPWR, and Gary Gustafson, who's our Environmental Training Director, and I are going to do a presentation for you. Hi, Gary. So I've got some slides that I prepared for this presentation that are really based on a new standard. We're calling it a standard that was released jointly by North America's Building Trades Unions and CPWR on Monday. We publicly released it. And if you don't have a copy of that, you will, from what I understand. And thus, I have a few slides to run through what we are expecting employers need to do at a minimum to continue to operate in this pandemic age. I have a really flexible schedule over the next couple of hours, but Gary and I have some prepared comments to make, and we'll be happy to answer any and all questions that folks may have, and just however you want to proceed. So with that, if we could pull up the slides that I have, I'm going to look at the chat box because there's a lot of people chatting. Okay. So with that, I'm going to try to close the chat box. And I see my slides being pulled up. Am I controlling these, or is somebody else?
Chris, if you could just let us know when to go on to the next slide and we'll control it.
Okay, thank you. I will.
Chris,
so, yeah.
Chris, also, this is Alice. I just wanted to, we'll keep an eye on the chat box for you. So don't worry too much about having to check it. We'll stop you and let you know if there are questions during your presentation.
That sounds great, and I feel very comfortable being interrupted. So however y'all want to proceed, I'm comfortable with that. So thank you for having us. We were really looking forward to coming in person. I had a plan to bring a whole bunch of our junior staff with us so that they could get exposure to you all, as well as us sharing information from CPWR. But instead of doing a general bunch of series of presentations as we had initially planned to do, we want to focus on COVID-19, what we're doing about it, what we have, and what our plans are. So I'm going to talk about these recommendations, the standard that was put out by CPWR and NAB2. We started actually as a result of some questions on a committee that Anton sits on, the Building Trades Apprenticeship and Training Committee. I started to develop a set of guidelines on how to deal with this crisis very early in March, and they've morphed into what is now what we're calling a set of standards, kind of a base expectation we have for construction to operate during these times, and these will change. But these guidelines that are now a standard were brought before the Governing Board of Presidents of the building trades, including your president, and the presidents unanimously agreed to adopt them. So they were shopped, and our partners in the industry were informed about them, and we received plenty of pushback, believe me, from our partners. And a lot of that really stems on the fact that OSHA is showing itself to be completely useless right now in protecting America's workers, and some other parts of the federal government have been failing greatly. So we started to put together these guidelines and these to do our best to protect workers. So you can hit into the first slide. And it's all about the construction employers, the expectation that they have a plan. You know, if you guys are OSHA geeks, which I recognize a lot of you, so some of you are, you know that, you know, under OSHA standards, employers are required to put in place a safety and health plan under subpart C, and they're not enforcing this, but this is what we expect. We have to have a plan in place on our job sites because this hazard exists on all job sites. And we feel that employers have the obligation to control recognized hazards. The hierarchy of control is something that we are very familiar with in the safety and health world. This is what we base our work on, and it needs to be followed in this case. And overarchingly, like, employers have to designate competent persons. They need to have somebody in place that we're calling a COVID-19 officer to actually implement their plan and to ensure that it's carried out. And of course, like OSHA standards require, training has to happen on this issue of what the hazards are and what the controls are. So Gary's going to talk about a couple of training programs that we've launched so far via synchronous online training using the Zoom platform. But really, what we're talking about is expectations we have of employers. And if you see this image on the right-hand side of the screen, I'm going to flash this up a few times as I'm talking. This is the hierarchy of controls that we need to follow and keep in mind. So go ahead and hit the next slide. Again, this is the image of the hierarchy of controls. We're pretty familiar with this in our work. You know, you first need to eliminate the hazard, substitute out, get rid of, replace the hazard, and then implement engineering controls to isolate people from the hazard. And, you know, once those controls are implemented, then you have to, if residual hazards exist, you have to implement administrative controls and also personal protective equipment as the last line of resort. So if you hit the next slide, we'll first talk about elimination. And when we talk about this hazards, we're talking about the hazards on the job site of workers who are infected and could spread the virus. So what we're asking is that workers be screened when they come onto the job site every day if necessary, but really self-identifying those symptoms that we know are associated with COVID-19 of coughing, fever, shortness of breath. This list has actually expanded since I put these slides together. These are the official CDC symptoms that existed at the time of last week. Now we've added a few symptoms that are associated with COVID-19 that are not on this list, and that includes chills and chattering of the teeth, sudden and new loss of sense of smell and taste, as well as sore throat and headache. I think that's the complete list, but the complete list has been updated in the standard that was released on Monday. And that employers should take temperatures of workers because the fever has been associated with this disease. So then we need to not have people who are infected and showing signs of the disease on the job site, obviously, and they should be given sick leave where they can get it. And really, in the construction industry, sick leave is now available to everyone under the Families First Coronavirus Recovery Act for all employers who have fewer than 500 employees. And we believe that those employers that are larger need to give their employees sick leave as well, of course. Work areas need to be disinfected, and contact tracing should be done. We hear about contact tracing a lot because we need to identify who has been in contact with someone who's sick and who could potentially spread the disease. So contact tracing is really best left up to public health officials. Local health departments need to be engaged when there are workers who are turning up sick on the job. Their job really is contact tracing, but it's also thinking about what do we need to, what do contractors need to do? You know, they need to keep track of people and know where people are and who's working with who and that type of thing. So that's the first one. First element is elimination. And if you hit the next slide, we're going to talk about the next level on hierarchy of controls that we see as being something that we can do and employers can do, and we know how to do it, and that's administrative controls. We don't have a lot of engineering controls that have been identified to be effective yet, so we've got to slide right down to administrative controls. And on the next slide, we'll start talking a little bit about that. That's distancing. Social distancing or physical distancing on the next slide is really one of the main elements we need to have in place for our workers to be safe on the job. If you can hit, thanks. So since the beginning, it's been 6 feet of space between people is what we need to do to reduce the spread of the disease. But, some folks would say, well, if we're excluding everyone who's sick from our job sites, why can't we not do that? I mean, we're screening people. Well, the answer is that we got a lot of people who are infected with the disease and spreading the disease who are showing 0 symptoms. So they are technically diseased, they're infected, and they're spreading, and they've got 0 symptoms. We don't know exactly how many. It depends on the geographical area. If you're in a hot spot, I've heard, at least 10% of the general population is infected and they don't have any symptoms. In some areas where there's not a lot of community spread of the disease, it may be down in the 4 or 3%. But then, I've also heard about a study in a community in Massachusetts, just north of Boston, where they were seeing that, up to 30% of the population in general was infected and they had the disease and they were spreading it without any symptoms. So there's going to be a lot of people who still have the disease and are spreading it, even if we have good screening procedures in place. Until we get to the point where we have enough tests that we can know the status of everybody who's walking around the streets in America, we are going to have people who are infected and spreading this disease. So this is where we need these other controls, administrative controls, this distancing. The 6 feet is probably not enough, I'm telling you right now. The 6 feet is based on the mode of transmission that is the official government line, that this is spread through droplets and spread through touch on surfaces. So droplets are like when you sneeze and you spew out a whole bunch of drops. And theoretically, when diseases are droplet spread, 6 feet is enough room. This is actually airborne, and we don't really have the federal government admitting it yet. So we have evidence in the scientific papers, and more of it every day, that you can still have issues further than 6 feet away. These live virus particles are suspended in air, and so we need to ensure at least 6 feet is taken care of. That's going to take care of most folks. Now that folks are using cloth coverings, that 6 feet is probably almost good enough, we think, where there's good air movement, but this is the minimum distancing right now that we need to make sure is in place. How do we accomplish this? And that's really about looking at the job site, staggering work, staggering crews, thinking about changing schedules, extra shifts to just reduce the number of people on the job and allow enough distance between people to ensure that this distancing takes place. And then there's the choke points. These are tough. We have, bottlenecks where you go into or leave job sites. There's the issue of high-rise construction and hoists and elevators. Very difficult to keep that 6 feet distance. The break areas, typically, we're seeing contractors just eliminate them and having people take their breaks separately. But then there's transportation. You don't want to transport a bunch of workers in a small bus around a job site, and you want to ensure that they're not carpooling on the way to work. So this is a big change in the way we do business in construction. And can I get the next slide, please? Another administrative control is cleaning these high-touch surfaces, and this is common advice from the beginning of the pandemic: social distancing and cleaning. And but it's new for construction. We have construction employers who typically don't go around and wipe down with disinfectant doorknobs, tools, handrails, portable toilets, and things like that. So this is new, and this is what we need to do to ensure that we're not spreading the infection through these surfaces. We felt it was important to ensure that disinfectants are available and replenished on the job site throughout the day so people can do this disinfection. And the next slide, please. When we talk about another administrative control, it's hand washing. It's what you've heard again from the beginning of the pandemic, but trying to get it through to contractors that they need to actually have running water and soap on the job so that their workers can frequently wash their hands is a challenge. It is the preferable method. It's better than using sanitizers because this virus, while it kills a lot of people in a lot of different ways, more that we're learning about every day, it doesn't stand up to 20 seconds of hand washing with a regular soap. You don't need an antibacterial soap. You don't need any special industrial soap. It's just any kind of soap and water will get the virus off your hands. People have asked me about gloves. Well, shouldn't we have everyone in gloves? And gloves are not a bad idea. However, the skin is an excellent barrier to this virus. So as long as there's hand washing made available to folks, and people typically don't use gloves in a trade or a line of work, then I don't think it's necessary to provide gloves to everyone on the job site. Alcohol-based hand sanitizers, where running water is not available, truly have to be provided. So, and then employers need to make sure that they give their employees plenty of time to actually do this, to leave their workstations, to wash their hands at critical times, obviously after coughing, sneezing, or blowing their nose, but also before and after using the bathroom and before eating, and then again whenever they feel they need to. So with the next slide, we'll go back to the hierarchy of controls. And at the bottom is PPE. We talk about personal protective equipment, and this is another area where our federal government has so badly let us down when it comes to personal protective equipment and this crisis. So if you hit the next slide. Personal protective equipment, cloth coverings and surgical masks are not personal protective equipment. They're not a respirator. You have the CDC issuing guidance that people should be wearing cloth face coverings in public. But we need to keep in mind that in a workplace, a respirator protects the respiratory system and is personal protective. Cloth face masks are not. They're not a substitute, even though you see people misinterpreting the CDC guidelines and you see OSHA putting out really bad guidance as it relates to cloth face coverings. Should they be used on job sites? Should they be required? I don't think it's necessarily a bad idea, but that doesn't take the place of social distancing, because we've got a lot of employers out there saying, well, we'll just have cloth face coverings when people have to work within 6 feet of each other. It's not the same thing. If y'all want to look into this a little further and learn more about the disease itself and what all the ins and outs are, CPWR did a webinar just last week, and we've got a recording up on our YouTube page. You can find it through cpwr.com, where Dr. John Howard, who's the head of NIOSH, probably the only part of the federal government that I still have faith in at this point, really walked through what the mechanics of like a sneeze and all about the disease. But one of the things he showed in his presentation was an image that they had somehow, with the light and everything else, shown the spray that comes out of a sneeze. And it extended about 20 feet out from the person who sneezed. So these droplets really do travel far. And if you have an infected droplet traveling far that has these infectious viruses in it, it can be suspended in air. So a cloth face covering is good if you want to keep those droplets close to the worker who's actually infected. They're going to decrease the distance that any droplets that person spews out, they travel. They're not respirators. They don't protect the wearer. Instead, they protect people around the wearer from that spray, from speaking, singing, shouting, sneezing, coughing. And they reduce the distance that the virus is going to travel. So that's why we see these cloth masks being recommended, just to keep droplets with the person who's creating them. That's really what they are. So what we're saying is that in our guidelines, in our standard, is that where you have close, unavoidable contact, you have to have workers working within 6 feet of each other. They need to be in an approved respirator with a complete respiratory protection program. The next slide, please. And I mean, you guys probably know this better than 95% of the construction workforce. What are respirators and what are not respirators? And these are examples of what we're talking about with respirators. Yes, there's the N95 filtering face piece respirator. This is the respirator that is in demand in our healthcare system. We can use these on the jobs, but they should really, in my opinion, be in the hands of the nurses in this country. But respirators are these other things: elastomeric face piece respirators, half face respirators, full face respirators, positive pressure respirators. So powered air purifying respirators are what I'm talking about, and equipped with any of the filters that are up here on this series. There's a lot of ins and outs to this. There's been guidance put out by the FDA, the CDC, NIOSH, and OSHA, which talks about respirators that are not within the certification schema. These are the NIOSH certified numbers that we would expect in a normal situation. There is allowance now if there are respirators that are imported and, say, certified under Mexico's certification schema, Europe's certification schema, and China's certification schema that are okay. They're pretty much equivalent to the N95. The only thing we do know is that, and what people are telling me, is that we've got a flood of counterfeit Chinese respirators in this country and around the world that say that they're certified under the China scheme, which is, I think it's K95. If they are legitimate, if they are genuine, then those are fine. But the fake ones, they're not going to give you the same protection as our N95s. So at least an N95 or higher. That is the presentation that I prepared. These are based on the guidelines that hopefully you have or will have in your possession and were distributed and released on Monday. They're also on CPWR's website and on NAB2's website, and that's where we are with it. We're trying to roll these out. We're trying to encourage folks to use them. I'm trying to encourage our unions to demand these protections for their membership. A lot of people have said, well, what does OSHA require? And OSHA is absolutely useless right now. They have put out bad guidance. They're not enforcing in a routine way. They're not helping our members, and I don't care what OSHA says. They've proven themselves to be absolutely harmful in this epidemic, and they've forgotten that they are charged with upholding the OSHA Act of 1970. So we are on our own, and that's why the standard was put out by the building trades and endorsed by your president and the other presidents in the building trades unions, and doing everything we can to educate folks about this. We're inundated with information and questions and everything else, so I've decided to create a clearinghouse at CPWR for COVID-19 information in the construction industry, where we're building it this week, and we'll be populating it beginning next week, and we're collecting everything we can, from governor's orders to reopening to safety programs required in different parts of the country to contractor programs that we think are good. And so stay tuned for that. And if you don't subscribe to our little emails that I send out once a month, maybe a little more often, just let me know, and I'll put you on the list to subscribe, so we can you can stay apprised of, you know, the information that we're trying to make available and share for you guys. So with that, I was going to turn it over either to Gary or for questions. Either way is fine with me. So I'll follow Rose's or Dan's or Ken's or Anton's lead on this.
Is there, go ahead.
Sorry, Ken. Chris, that was awesome. I agree with you 100%. We need to hold our members, our employers' feet to the fire for our members. OSHA's not going to do it. They're not putting out good information. If you read through the OSHA guidance plan, you know, we're classified as low risk. They talk about they talk about high risk industries, and I understand how high risk the healthcare industry is at this point with the virus, but just because we're low risk doesn't mean that we don't need to be protected. And you know, the guidance that's coming out from our federal government, that's coming out from the CDC, that's coming out from OSHA, telling people to wear cloth face masks, telling people if they just stand 6 feet apart from one another, they're going to be okay. It's despicable. And you know, we all know better because we're involved in it on a daily basis. But you know, when you see this on the news, you know, you hear people talking about it, they don't know. And it's our job to educate them. It's our job to make sure our members know what to expect. It's our job to make sure our employers are doing the right thing. You know, the GP, I put it in the chat box too. The GP sent the guidance that you all put out. You know, he sent it out to all of our business managers and contractors on Monday, along with a link to the work plan that Bernie helped us put together. Actually, Bernie pretty much put it together. That's 100% in line with CPWR's recommendations, and that's what we're telling our contractors to use to develop their site work plans. You know, and stick to the stick to that guidance and make sure that we're protecting our members. So, you know, Chris, great job. Thank you. Great information.
Great.
Hey, Chris, this is Ken Seal, and I'm glad that you guys did put something out. Because a plan is great, but if we're not all following as the building trades, all the contractors out there that have employees on a work site aren't following a plan that's standardized, you know, so we all are following the same rules, then it doesn't work. And I think this will help standardize a plan that our contractors can follow to keep our members safe. So I appreciate that.
I just want to respond to something I see in the chat box. I haven't read through all of it, but one thing that Phil, you said is making it mandatory to wear N95 filtering face piece will require a fit test, and I couldn't agree more. We need a full respirator program for everybody who needs to wear a respirator if they have to work in close contact with other folks. A fit test, a medical screening program, a written program, a training that's not just handing out Appendix D at 1910-134. And this is a change. I mean, this is serious. You guys follow the news. We've never seen anything like this before on Earth, and we are writing the history that people are going to reflect on. And I lost my cool on the phone with a contractor last week who's talking about the fact that they simply can't do this. And I'm like, you know, we don't feel like you have a choice, because there's no going back. I mean, a lot of people are going to catch this thing and they're not going to be seriously affected, but they're going to spread it to people who stroke out when they're 35 years old. I mean, this is affecting all the organs in the body. We're learning so much every day. It's just absolutely staggering. And, you know, we're going to figure out how to beat this thing, I think. But in the meantime, it's not really an option not to protect workers and to spread this disease on our job sites. It's just not an option. So, okay, thanks for letting me vent a little bit.
Chris, if I can add to what you said, you know, at least one of our district councils, I think there was a couple of our councils actually told their members not to go to work, which is a very difficult decision to have to make, to tell your members not to go to work because they couldn't be protected on the job. And I've had the same conversation with a couple of our contractors. One of them is a good friend of mine, and he said, Anton, we can't get N95 respirators. We want to put people with a face shield and a bandana. And you know, I said that's not going to do them. That's not going to do anything for them. That's not going to help them. That's not going to keep them safe. And he said, well, I can't get them. What should I do? And I said, it sounds like they shouldn't be on the job site. And you know, it's hard to tell somebody that we shouldn't put our members to work. That's what pays the bills. That's what pays all of our salaries. That's what keeps the lights on. That's what allows us to pay for our training programs. But if we can't keep our members safe on the job, they don't need to be out there on the job. And if N95 respirators aren't available, put them in a half face. If a half face isn't available, put them in a full face. You can always step up the protection. And yeah, it's going to cost a little bit more. Yeah, it's going to take some training. Yeah, we're going to have a program in place. But the alternative is our members die. And then they're not working, and then they're not making money for the contractors. There's lawsuits, there's bad press, there's all the things that go along with it. But the most important thing is we need to protect our members. And I think it's better to step up the protection than to step down the protection, which seems the direction that a lot of our contractors want to go. And it's not just them. The GCs are forcing our contractors to fulfill their contracts and do the work. You know, we need to help support our contractors in pushing back on those GCs as well.
Yeah, and I appreciate that. And one of the things that's frustrating for me, you know, I've spent my entire career for the building trades since 1996 when I started working for you guys, trying to fight for good protections for workers on the job. And we just can't go in a negotiating stance right now. We have to just keep people alive. We don't have the leisure of waiting 50 years to see if we're going to pick a level of protection that allows 200 or 5,000 people to die from their work. We just don't have that luxury right now. We don't have the ability to wait and see. So that's part of where I've been coming from, and I feel very, very fortunate that the leadership in the building trades is on the same page. So thank you.
Yeah, I have a question, if I may.
Sure.
As we discussed in 1910.134 Addendum D, states that for voluntary use of a face piece mask, it is not required that you have to have a fit test. When we're developing these plans for our schools, do we need to fit test the students? Obviously, that has its own dangers with doing that, but technically we're not their employer. And it does state that the employer has to fit test them if it's not mandatory. If we put it in our regulations that it is mandatory, but we're not their employer, what do we do then?
Well, I don't want to tell you what to do in your schools. I don't think that's my place. But I think that, you know, as you're planning to bring your participants back into the classroom, really thinking about the social distancing, if that can be accomplished, at least at this time, our guidelines are not calling for respirator use. It's where it cannot be accomplished, like a two-man lift or close work. So really thinking about how you bring folks back into the training centers, you should do it really thoughtfully, and if at all possible, with social distancing. And you know, because we're learning more and more about the airborne transmission of this, there may be tweaks that we learn that can be employed in your training centers to the ventilation, to improve the ventilation, increase the amount of air that's moving through. That could make a great difference, but we don't have a lot of science on that yet. But it's just something to think about from your point of view. I don't think it takes the place of the at least 6-foot rule, and the disinfecting and the hand washing and all that stuff. But you know, it is something to think about how your individual centers are configured. How might you be able to tweak them to change the ventilation?
Folks, this is Bernie. Mind if I chime in with something?
Go ahead.
Go for it, Bernie.
Yeah, so if we just take the issue, just looking at respiratory protection, and I mean, I say this because as directors of training, you are all health and safety advocates at your district councils. You care a great amount about it. The fact that we're having such difficulty getting employers to even recognize what a respirator is, what does fit testing mean? Do you have to be medically cleared? It unearths an ugly truth that we've been significantly deficient, even in the United States, of having the bare minimum of health and safety standards within employers. And it's not just in construction, it's in general industry, it's in maritime as well. I can't tell you how many, dozens of times I've gone on to do inspections on sites. And I ask for, can I see your written program on respirators? Well, what do you mean? I give a training. Yeah, but where's your written program? Well, what is that? So, it's no wonder that when we've got, a microscope on many employers now, because we've got this pandemic, we get to see with the curtain pulled back, a lot of them don't have the basic health and safety protections that were the bare minimum mandated by OSHA to begin with. So it's something to think about. This is an unfortunate situation, but it can very likely be a good labor movement to push health and safety on many levels to a new level where it should be. That's all.
Bernie, if I could add on to that, one of the to answer the question another way, while we might not technically be the employer, if we're putting one of our apprentices in a situation where we can't eliminate the hazard and we have to put them in PPE, we need to make sure that they can safely wear that PPE. If you're comfortable looking at a fit test that an employer did and saying that meets my standard, I know you can safely wear it, that's one way you can handle it. Another way you can handle it is have a written respiratory protection plan for the facility, for the training center. Conduct fit tests. I know there's a cost associated with that. But if you're going to put a member in that situation or apprentice in that situation, whether it's a COVID-related hazard or they're in a spray booth or they're in welding or they're doing whatever activity, we can't eliminate that hazard. We can't have those administrative controls in place. We need to put them in PPE. We need to make sure that they can safely wear it. Splitting hairs about whether we're considered an employer or not is, take that issue aside. We need to keep our members safe, and I think that's the standard that we need to adhere to, not just the legally what are we required to do. And like I said, I know there's a cost associated with that, but we need to lead the way rather than just do the bare minimum. And we don't have, I'll fess up like I try to do every opportunity. We don't have a written respiratory protection plan at Hanover. We don't have one here for our employees. We don't have one here for our apprentices. Before we bring students back in, we will have one, and you guys will have a copy of it. So if you want to, I know Al likes when I say templates. If you guys want to use that as a template so that you can create your own program, we'll make that available to you. But I think it's imperative that we make sure that when our members are at risk, whether they're on the job or at the training center, that we do everything we can to mitigate that risk and protect them.
This is Ken. Sorry, Bernie. This is Ken. If I may, I just want to make sure. I know that we're talking about the N95s and respirator fit tests and all that stuff. I just do not want us to forget that in a lot of our training facilities, we have a shared mask that everybody seems to have, and that's the continuous flow blast hoods. That is a respirator. We need to take that into account. We can't forget the fact that those either have to be sterilized prior to the next person using them, And that doesn't often happen. It's just wiped out real quick with a little alcohol wipe, and then it's handed to the next person. We really have to think of that too. So don't forget that avenue, that there's some things that we do already that we have to look at.
So I just wanted to piggyback off of what Anton was saying, and you're spot on with developing a program on respiratory protection. And there is going to be probably some legalese in a discussion with an attorney where your students fit. But I'll tell you, I will not fit test any worker until I have confirmation that they've been medically cleared by a qualified health professional to safely put on a respirator. Not even just for that, that 10 minutes that they're going to put it on to have a fit test. One, because the standard says that that's the law under the respiratory protection standard. But two, they could have an underlying heart condition, high blood pressure, something where they put on, an elastomeric respirator, a tight-fitting face piece, and it only takes, breathing in that thing for 2 minutes, and then they get a heart attack. So it's really important, and I've had to come to some serious terms and parting of ways with some clients because they demanded I fit test workers before they had their medical clearance. I said, I'm sorry, man. One, I'm not going to break the law, and two, I'm not going to break my code of ethics as a CIH. So, and again, somebody brought up the point, well, where do students fit? I look at it as, because again, I've worked at a training center for a number of years. If you've got folks on site that you're responsible for and caring for, right? You have all these other programs in place so that they don't fall when they're doing scaffolding classes, et cetera. Wouldn't you want to take the same care about putting on a respirator? So it's something to think about for sure. Where do students fit when you put them in respirators?
Great stuff, Bernie. With the time and all that stuff, we're going to have some really great time at the end here for some great questions, but I need to get Gary into the fold. So if we can get Gary to go, that would be fantastic. Thank you.
All right, Ken, let me get these shared here real quick. All right, is everybody seeing my screen? All right, so I just want to continue on with what Chris was saying. So CPWR at the start of the pandemic, at the request of a number of unions, we looked at how can we continue on training, especially as we were being requested to do, actually it was the ICRA, the Infection Control Risk Assessment, which many of you, as I look throughout the screenshots, I've had many of you in my classes, and it was good to see you. So what we looked at is how can we retool the ICRA class, which deals with infection control from the patient perspective, but also now to look at the pandemic that we were in the middle of and how do we address both audiences. So I just want to share with you what we've done. So as Chris mentioned, CPWR chose a live distance learning training platform. We believed that a synchronous, not asynchronous, the synchronous platform was the way to go, especially as we were looking at the new topic of the COVID-19 pandemic, because we didn't know what the questions were going to be. So as we started to get our feet wet in this training program, we felt it was important to offer a platform that allowed the participants to address the instructors in a very timely manner, so that way questions could be asked, answers could be given if they were available. And so that dialogue became important. The other thing that we liked about, we chose Zoom as the technology because I'll be frank, it was the one that was in, sort of in the news the most. And so fortunate, I have two teenage children who also had, some experience using it in the classroom. So, we jumped on the Zoom technology. And after doing some further exploration, with it, luckily we had two staff from CPW. Well, one's retired now. You all know Spencer Schwegler. He had been turns out he's our Zoom expert. He has been using Zoom for a long period of time. And Mike Kassman our director of our OSHA program and our disaster response, had been doing college courses utilizing Zoom. So we had a lot of experience in the Zoom. So that was fantastic. And the other part of that we liked about the Zoom was the ability to do participatory activities. Using the polling feature gave us the ability to do quick check-ins, what we called assessments, to make sure learning was happening both pre and post. And the breakout rooms has been really a lot of fun because it enables us to ensure the students are not just sitting there behind their computer monitors or iPads or whatever it is, but there's actual engagement, active engagement. So we really do like this technology and do recommend it. I'll explain some of the challenges we've had with Zoom here in a minute. So the first course that we put together utilizing was the response to the COVID-19 pandemic, which was our awareness course. Now, as Chris just went through the NAB2 CPWR, I have to update this screen because, as a matter of fact, just I gave this PowerPoint to you guys 2 days ago, and now there's been an update. So the guidance, which is now the standard, has to be updated, which actually the entire PowerPoint has to be updated to reflect the new standards that Chris just went over. So we're in the process of doing that, but the training that we have delivered was based on that guidance, as well as guidance that was provided to us from our granting agency, the NIEHS, which you see the slide there. I know Bernie, you sat through a number of the webinars that NIEHS did. So we were able to use a combination of resources, our own as well as other entities, federal government agencies, which gave us the background to put this course together. I have tagged it right now at 30 minutes. I can guarantee you that based on the information that Chris went through, this might add a little additional time to the COVID-19 course, because there's a lot of great information in those standards that needs to be communicated, and that will be added. And just the goal of the course was to increase the health and safety awareness for construction workers who are impacted by the COVID-19 pandemic. So it's really kind of a broad statement, but we wanted to leave it that way because we knew we knew everything was changing daily basis. What happened on one day may change for the next. So we wanted to give ourselves that flexibility. We identified 3 objectives that we wanted to achieve in the training, which was, we felt that for the membership, we did have to give some basic facts about COVID-19. I can't tell you the number of times I'm still finding on social media people sharing pictures of some sort of animal medicine that says canine coronavirus from 2001. And it's like, yeah, we've had coronaviruses. And so we felt there was some need to explain the basic facts about COVID-19. We had to assess the risks of the workplace exposure and define some key steps in worker protection. And now, based on the new standards that will be that are out from NAB2 CPWR, we're adding a 4th objective, which outlines the employer responsibilities for the workplace, and we're currently adding those as we speak. So just in general, so we talk about what is COVID. We talk about, there are many types of coronaviruses. We talk about, what's a little bit different about the COVID-19 as it relates to, the previous coronaviruses such as SARS or MERS. Chris just talked about transmission. So we do spend some time just talking about the different methods of transmission and and how that impacts what we're going to be talking about in the course, and why we're the guidance is talking about the different aspects that you're seeing on the news, between social distancing and face coverings and all that information, because it's all based on these transmission protocols here. We talk about the CDC symptoms, as Chris mentioned. The initial 3, which were, fever, cough, and shortness of breath, have now been expanded. So we need to talk about the other symptoms that are showing to be evident in COVID-19 patients. So we need to spend some time explaining all of those as well. And now we want to, in the class, we felt obviously we need to talk about the protective measures. And we thought it was important to talk about what we call the precautionary principle, where, that to reduce risk, we didn't have to wait for scientific certainty about the nature of the hazard. That, we feel that there's enough evidence that, we need to start protecting workers based on this precautionary principle without having, the scientific background to say, yeah, that's right, or no, that's not. And, it needs to be done differently. And so then we just go through with the members. We talk about the different things each of us can do as individuals. So we just we reiterate those protocols that we hear in the news, or we read in your newspapers, or are passed from our unions, just as general members of the public. And we've talked about them, washing your hands and sanitizer and covering your mouth and don't touch your eyes and stay at home when you're sick. And then we bring that over to what the workers can do. So then we take those individual precautions. We say, okay, how does that work on the job site? So now we talk about, avoid large gatherings and stay 6 feet away in the job sites and don't shake hands when greeting. So we convey the precautions over to the workplace. And then as you see the our handy thermometer that Chris was showing here, we talk about what recommendations for employers. Now, this whole section is what's going to be changing based on the standards that NAB2 CPWR put out. So all of this is going to be updated to reflect the information in those standards. But we felt it was important to prepare members that there is a responsibility from the that we're saying employers need to take. And as Chris had mentioned, it's not because we're going to get it from the federal government. It's because it's the right thing to do. It's what's needed to protect them on the job site. And then we have our second course that we did. So that's our COVID-19 course, which is a standalone, just dealing with COVID-19. And then we had a call for putting our ICRA awareness. So that one-day course that we had developed. And so we paired it with the COVID-19 information that you just, I just went through. And we've identified it's a 5-hour course. After doing a number of sessions, we identified that the amount of material takes about 5 hours to get through. As you know from your own dealings with Zoom meetings, sitting for 5 straight hours, though, and Bernie, and I think, Chris, you may have even had to endure this from our NIEHS folks who made us sit through 5 hours of one Zoom meeting. That can't be done. You can't sit through one 5-hour presentation. It's just, your brain just can't absorb that much time on a screen. So we divided our course into 2 sessions conducted over 2 different days. And we feel that after having done a number of these courses, that even with the breakouts that we have and the way we utilize our trainers, we use up to 5 trainers in our ICRA COVID class because of the breakouts, because of the participatory activities. We feel that we need that much support in the class, but it allows us to accommodate up to 40 participants. So we can handle surges in training needs. So the goal of the ICRA COVID is to address the need of the healthcare, the health care awareness for construction workers, as well as the COVID-19 pandemic information. So it's a combination of the two. What we typically cover in our class is, what is ICRA, the infection control, where it's used. We do talk about behaviors and rules regarding our construction workers on these sites, because remember, we had in the beginning and still to today, we actually have a number of members who are going into healthcare facilities as a result of the pandemic to expand capacity. And so they needed to have an awareness of both the ICRA and the COVID. And we also talk about hospital-acquired infections. We talk about the ICRA precautions. And then that gave us to your involvement. So when these 2 courses became available, Ken reached out to Chris and then through to me to say, you felt the need to do training for your trainers. So CPWR conducted both the and the ICRA COVID-19 training to a little over 30 of your trainers attended both courses. And I have to say thank you, because we learned a lot from your, from having your folks in the class, because you gave us and our trainers some additional questions that, caused us to stop and think about, how we needed to present materials, as well as, some ideas on what we might be, questions we might be facing from members. So I do want to say thanks to all of you. I know a number of you in the audience were in those classes, and you guys were a big help, and I really do appreciate what you did. I know Ken and Bernie, you're going to be talking about this in a little bit more detail, but I just want to give a brief review, because as it applies to all of the NAB2 unions, the training is funded by a grant from our NIEHS award through to CPWR. It can be used to reimburse, local training centers, JATCs, for trainer salaries and benefits. It's got some limitations, but I'll let Ken and Bernie, get into more detail about that. And the only thing that we do have some requirements, because it is grant funded. So if you are, if there isn't a need to take advantage or a desire, we do have to collect our CPWR forms, because we do have to report these classes back to NIEHS, and they have certain parameters that we have to follow. So we do need the information that you're probably familiar with. If you've been to any CPWR brick and mortar class, we have to collect that same information, but we can assist you with the collection of that information. It's the great thing about CPWR. We have a lot of assets in our organization. And so research partners, and we were able to utilize a survey collection software that they have, which we were able to retool to help us in training. And that was as I mentioned, that we had a challenge, and that was our biggest challenge. But because of that collective, resources at CPWR, we were able to overcome that in a really quick time and put that in place. So we're able to meet the challenge. So with that, I'll open up to any questions, but I got to give my due diligence here. This was funded, part of our NIEHS award. So there's that. So that's what I have. So Ken, if you want to open up the floor to questions, I'd be happy to, or we can move right into what you guys have been doing since you've taken the CPWR training.
Hey, Gary, before we get started on questions, since you brought it up on the grant funding, I want to let Nicole speak for a little bit here on how we're going to proceed with that. So that way the directors of training kind of understands how it needs to flow. One important thing that I need everybody to understand is that if we get a call from whoever at the international, at a local level, I don't care what state, what region, we need to make sure that we have a number that we can put out there. Because one thing we're going to do is make sure that we're selling ourselves correctly, that the fact that we have this training and we're prepared. But we all need to be able to grab that number of how many people we got trained at once. We can't go searching for it. We have to have that number. That's very important across the regions. Because if somebody needs it in the West and you guys got it in the East, we need to bring people over. So, I mean, that's really important. So, Nicole, if you want to just kind of go over the process, because I think it's on everybody's mind of how that grant money is going to work and how we need to follow the process.
Sure. So we want to make this as easy on everybody as we can. What I would start to think about as a director of training is when you would like to have, when you're going to have your instructors, up to 4 of your instructors, conduct the ICRA awareness training at your training center. If it's going to be you as the point of contact, or if you're going to have one of your trainers be the point of contact to submit the information that CPWR is going to need for reimbursement for the wages and benefits for your instructors. So kind of do that pre-thinking now. We'll keep the process fairly similar to what we have already. You would send, the DOT would send in the class request to the ATR, FTI request, and CC me on the email. So it would just be the normal FTI request form, include a roster with it. We will notify CPWR on your behalf of your training and when you would like to request the class. CPWR will then get back in touch with you with the linking of the documents and the training information. Either you or the person that you designate as your point of contact. You guys send out the links to your students. When it's all said and done, you need to send in a final attendee sheet, probably a sign-in, sign-out sheet, and whatever other required documentation is needed for the grant reimbursement. But at the very end of your class, we just need to know who took it. And then CPWR does require a certain amount of backup information. So what we're doing at the FTI is we'll come up with a template and a draft for you to use, so you can just fill out the information, because they'll be reimbursing your fund directly. So we would need your fund information, how many instructors that you had, the number of hours of the class. But like I said, we'll put all of that together on a sheet, like an expense form almost, and then that's what you would use, and you would work directly with CPWR to request those class hours, to request the wages and benefits back from them after you have a class. So any questions there right now?
No, that's great, Nicole. I'm glad that we brought that up on how that process is going to work. And again, I can't iterate enough of how important it's going to be if any one of our district councils or the IU gets a call on a pandemic or an issue and they need help. At that point in time, we will not have time to search of who has the training and who doesn't have the training. We need to have that number readily available at our hands at all times. And this is one way we can make sure we have that available. So it's just going to help us all in the long run. Nicole, I think the only thing that might be of question is, I know our typical time frame are 6 weeks and our 6 months or 90 days. I think it is what it is, 6 weeks and 90 days. But I think that's going to change a little bit with this, correct?
Yes. So I think we probably like a 10-day leadway if you can, 10 business days if you can. It's not a whole lot of paperwork. What I would suggest is that we just don't say, hey, I want to put, today's Wednesday, let's not try to put one on Friday. Maybe we could do Wednesday, Thursday of next week, perhaps. And yes, Gary just put something, yeah. So, and the other part of it that I didn't go over was the templates for completion cards and completion certificates. So CPWR has given us those templates. So after you're done hosting the class, you would be responsible for giving your members the completion card and the certificate. There's also been some discussion between the IFTI and everybody about these the hard hat stickers. Haven't gotten too far on that yet, but I'm sure we'll figure it all out. But we have basically everything we need at this point to go ahead and start conducting the classes. It's just a matter of when you all are going to be ready to put them on, and we just start from there. And we should, like I said, I'm trying to keep the process as easy as possible. But like Ken said, it's important to know how many people are going through this at a minute's notice, so we can kind of see where we can pull people if needed, where those hot spots are, where we need to get people trained. So that's kind of the motivation behind that.
Thanks, Nicole. I appreciate that. And then again, we'll get that information out. We'll get the templates out on how to follow it, and we'll help you work through the process. It might, take a couple to get through, but I think the process is fairly easy. Me and Bernie actually went through the COVID and ICRA course ourselves. I filled out the paperwork prior to the class. It took less than 5 minutes. I filled out the paperwork after the class, the survey. It took less than 5 minutes. So it's actually a pretty quick process, but that paperwork has to be done to make sure that CPWR is covered on their side for their grant money, because they have to have backup paperwork for everything that they're doing for their grant funding. So I appreciate that, Nicole, very much.
Ken, can I throw something else out there?
Yes.
We're in a really wacky grant year. So if you have demands that exceed what's budgeted for in your subgrant, we may be able to cover additional. We'd love to send more money than we plan to do this training. So just kind of keep that in mind. If you're, as we're moving through this, we'd like to spend all of the money we've been awarded. And if Gary's laughing because nothing is better than a grantee who spends all of their money in the eyes of our grantors, and who does training that exceeds the plan. So if you budgeted, say, for just arbitrarily, I'm making this up, 100 classes, but you do your 100 and you go through all the budget and you have another 50 classes that all the paperwork's in order for, we may be able to increase the amount of training that we've funded over what we've planned at the end of the grant, near the end of the grant year, which is going to be coming up on us before we know it. So thank you.
Great point, Chris. Great point. So we'll continue that process. But we're gonna, for the time's sake, and I want to make sure that we get it all in. Bernie's coming up with some great stuff. But if we can go to that first slide, Alice, that would be great. Or the second slide, actually. We can just go to the slide 2. There we go. So we're gonna have this ICRA course, and we'll be adding some additional materials. Me and Bernie's been working together on just complementing what CPWR has, and what I mean by complementing is really actually making it fit the IUPAT and our members and what we do. I think more than others, we are more prepared for situations than others. So we're gonna enhance it, complement it, and really make it fit us for what we do. So we're gonna complement what they have already had, and Bernie and I are working on that, and we're getting close to having that finalized. We're gonna expand on general infectious disease. We're gonna really hospital-acquired diseases. I know COVID-19's heavily on everybody's mind and thought process, but we cannot forget that there's other hazards out there. There's other hazards that are killing people and hurting people and making people sick. So we really need to focus on the overall picture, and not forget that it's bigger than the COVID-19, even though COVID-19 is huge right now. Discussions on where ICRA could fit in disasters. So some of you know that when a hospital makes an emergency plan, part of that plan, one of the critical parts of that plan is surge hospitals or surge rooms. So when a hospital is designed, put together, and engineered, some ICRA controls are involved in that. And one of those controls is, what do they do when they run out of beds? Because a hospital is designed for the area it's in, the amount of people that's within that area, and how many people they feel will get sick on a lot of the common, like colds and that type of stuff, and then also people that get injuries. So they have to have a plan when that increases. And if we all seen the boat that came into New York, we've seen these hospitals pop up in parks, of course, and we also know that the COVID-19 was not planned for. So I mean, there was a lot of quick thinking, a lot of things that was trying to be put into place to handle that overflow. I can say that after we get to a point that they're going to have to relook at their plans. So where does ICRA fit in a disaster? It's going to fit in more tomorrow than it does today, because they're understanding the fact that all these means that are put in place help protect the worker, the patient, and everybody around. So with all the news that's out there, all the CDC guidance, and all of our guidance, that's gonna grow. So this ICRA is gonna be something that is gonna be important. I think that we should all take it serious and understand that this is not the last disaster, and that the IUPAT's in a spot right now to be ahead of the game compared to any other IUP or building trade unions out there. We are in that spot. We just have to make sure that we're selling ourselves the correct way, right? So if we get members trained, we need to make sure that we're out there and letting these hospitals and all these healthcare facilities understand the fact that we have trained members and we are ready for any type of disaster, any surge that they might have, we have the trained people to do that. We have to get out there and let them know that, that we have that and that we're ready. So disasters are gonna be big, and we're gonna be prepared for that. Me and Bernie are actually, and some of the district councils are working on some activities right now. As you know, we're all, I don't think any of us are in our training centers, or at least have members in our training centers. So we were working on some activities and really making our members shine out on putting up, you know, doorways, zip doors, Z-lock doors, negative containments, clean rooms, all that stuff. So we're working on with some of our DCs on that. And then the importance of, I know it was brought up a couple times in certain ways, and the importance of following workplace rules, right? Workplace rules are important. They're put in place for a reason, and we can't just have one of our employees or one of our members not following those rules. So it's like open up your training centers and you have a set of rules and you let one person not follow them, then it hurts everybody else. So we're going to really explain the importance of following the workplace rules, the consequences around what happens when we don't follow those. Next slide. It really is going to provide a lot of skills. The ICRA training is going to provide a lot of skills for working in traditional healthcare settings, just a regular operation in day-to-day scenarios. It is required pretty much in all hospitals that there's some type of ICRA control. And I truly believe that there's going to be more ask for ICRA trained construction workers than there has been in the past. So in traditional healthcare settings, it's going to be a big need. And then, as you heard, that I talked about the surge hospitals in case of a human-caused event or a disaster. But I don't think we've seen the last of it. I think there's going to be more put into a hospital plan, like I said, and we need to make sure that we have a plan developed. We have the workers trained that understand how to work in these environments and keep not only the patients within the hospital, the workers within the hospitals safe, but also the workers that are working in the hospitals safe. And I think we're set up more than anybody else to do that. So next slide. So this is just a kind of a focus that we were talking about. We were talking about 64 total master trainers. What I mean by that is we have 36 right now that have went through a course on ICRA. So we've got a good number. We have 36, which is good. We would like to see, at least 2 trained instructors per district council, at least. But it can grow from there. Don't let that, that 2 just say, oh, we only need 2. Really think about your plan. Really think about the work availability that's going to be out there, and let's get some instructors trained so we can get our members trained and make sure that we're prepared. We are actually, me and Bernie and some others are working on, the curriculum partner is working on a workers course for both trainers and members. We are taking and just really, like I said, complementing what CPW already has out there and making it kind of our own. Develop options for workers course online and in person. We are, like I said, developing our course where it fits us. We have 36 trainers out there that are ready now to start that training. I suggest that we all work together across regions and talk to the instructors are talking to each other of what's working, what's not working, what kind of questions are getting, and things that they're doing to make their course better. It's one of these things that across regions, it's important for all of us to know. And so with that, Alice is going to put up a poll, and the question would be is what % of members can you train in the first year, and then in the second year, and then in the third year? So think about, what you feel you need to train in one way, and how many that you feel you can train in the first, second, and third year. And Alice, there, thank you. And so this poll will be up for a few minutes, so we'll give everybody a time to take this poll. But as you're taking the poll, I just wanted to enhance on the fact that how important this is. Nobody had a plan for COVID-19. We had emergency plans. We put emergency plans in place, which helped out a lot, but we're still trying to develop things within that plan. The healthcare facilities did not have a plan for this many people and this quick. And so their surge that they had was more than they expected. So again, when they go back to the table, they start talking, their plans are going to include a lot more on what happens on surge hospitals. If we have the members trained, we can go to the area hospitals, healthcare facilities and all that, and let them know, let their leaders know that we have members trained and ready. We might be able to be part of their plan development. And if we can be part of their plan development, and they understand that we have the workers to cover their surge, I think that's a big deal.
We're at about 44% participation in the poll, so we'll give it a couple more seconds.
Yeah, just let us know when that's up, Alice. That would be fantastic.
Okay.
I know that we've had, ICRA courses going on. I know that some of the areas you can't get in the hospitals without ICRA trained. I know, just to give everybody a heads up, carpenters have had ICRA for a while. We felt as the building trades that the carpenters ICRA could not be the only one out there. So CPWR that's one of the reasons that we said as a building trades, we're going to develop our own ICRA course. So let's just, I'm just saying, at least on my opinion, let's work hard and be ahead of the game, be ahead of the curve, and be ahead of all the other ones that are out there. This is like one of the questions that came up is ICRA is not required in Ontario. And in a couple areas, I don't think it is required, but with all this is my feeling, with all the talk that's going out there with COVID-19 and the precautionary measures that is taken to protect people, the ICRA is going to become more of a norm than it is not required. So, Brian, that's how I would answer that question is I feel that it's going to become a requirement more tomorrow than it is today.
Okay, it looks like the polling has stopped, so I'm going to end it now.
Great. If you can go to the next slide would be great.
Yep.
I'm going to turn it over now to Bernie. It's been a pleasure to be able to work with Bernie. He's got a lot of knowledge and a lot of background of this COVID-19, ICRA, and other sources out there. And it's just been a great pleasure to work with Bernie. And it's nice to have him part of our team. Bernie?
Thanks, Ken. And thanks to Chris and Gary. That was a great couple of presentations you gave. And Gary, gosh, I think we're going on 20 years now of knowing each other, which means I might be approaching middle age or something. Is that how that works? Anyway, what we're going to do here is I just want to go over some things that I think might be pertinent to directors of training, not just for helping give information out to their members for going back to construction sites, but also because you run facilities, training facilities. And not to mention, I bet a good portion of IUPAT work is done in a near complete structure. So you're putting paint on interior walls, you're doing wallboard, you're taping, you're doing floor coverings, this stuff where you've got enclosed buildings. I mean, we're not talking about, steelworkers connecting members and things like that where you've got big open breezes. So Consider too that IUPAT construction sites might be a little bit different looking than what they would look like at the start. And that's going to have some issues with it as well. So I just want to cover here where OSHA, where OSHA stands, transmission, symptoms, respirators and face masks, returning to work for construction sites, returning your training centers to operation, and then some of the stuff that the IFTI has developed and has been developing on an ongoing basis during this event. And I just want to further something that, Ken said. He's absolutely right. I mean, once the dust is cleared from this, hospitals, hopefully the federal government, they're going to start doing after action investigation and discussion about, what went wrong, what can we do better. And there's going to be a clear understanding, hopefully, some things that are going to have to increase for, the next time this happens. And the next time could be as soon as the winter or maybe even the fall. It really depends how, we operate right now and we get back to work and what methods we do that by. So with that said, we're just going to go through some of these slides. And again, think of it not just as construction sites, but as a training site operator, some of these things might be pertinent to you as well for getting your students back in the seats at these centers. So next slide, please. Chris gave mention to this already. OSHA relaxes standards during this pandemic. I got to switch my screen around here. During the COVID-19 pandemic. This is just a few of the mandates that they put out in April. So we see from April 3rd, the most recent one is April 24th. There could be another one that came out since then. I don't know. They come out with them quickly. Number one, US DOL issues guidance on respiratory protection during N95 shortage due to COVID-19 pandemic. And so they started to relax what kind of respirators can be used where. They next started to relax what kind of fit testing can you do. We know the best fit testing is quantitative, but then they went down to doing qualitative fit testing. From there, they started to look at enforcement guidance for recorded cases. Now, if something happens to you on work, it's work related. So it should be an OSHA recordable, but depending upon the event, the accident, the illness, etc. Well, the enforcement guidance now has relaxed that, where if you're not in a healthcare setting and you get COVID-19, let's say on a construction site, at an airport, as a public transit worker, it might not have to be an OSHA recordable, because they're saying that it could be really difficult to prove that you contracted COVID-19 on that work site. And from there, it just goes downhill. The next one was reported in Reuters first. OSHA directs inspectors to send letters to employers requesting that they conduct their own investigations of worker complaints and report the results to the agency. So it's they get to police themselves, basically. And then we've had a few more guidance issues come out, around basically good faith efforts on employers, because they might not be able to send people to, say, get medical clearance for respirators. They might not be able to hold trainings. So they're going to relax their enforcement of certain standards. And then finally, we get to issues about deconning filtering face pieces. These N95s, N99s, and 100s, these are throwaways. These are single-use, disposable. They're not meant to be reused. But during this shortage that we have, a number of agencies, organizations have been trying to find ways to reuse these, to disinfect these. One of the problems with this is if you disinfect them, depending upon what method you're using, you're going to actually negate the properties of that filtering material, and you're going to make it less efficient. But the DOL put out some guidance on that as well. Depending upon what method you're going to use, they've either blessed it or not blessed it. Next slide, please. So again, we can see, OSHA, I hate to be so pessimistic, but OSHA has really let the workers down here during this pandemic when we need them the most. Now, I just want to cover transmission. It's really important, especially if you're in charge of, a workplace, a training center, to understand how transmission is working. Chris covered a little bit of this. I'm going to go into a little bit deeper dive on some of it because it's very important. you know, we have different modes of transmission. You have airborne, which is one of the most dangerous ones because it can float around out in the air and travel far distances. Droplet, where you've got to be within the 6 feet. Contact, where you've got to be in direct contact with something that's infective. But I'm just going to cut to the chase. Almost all of the research, if somebody was reasonable reviewing it, is going to say this is, without a doubt, airborne transmissible. What does that mean? Throw the 6-foot rule out. If you're going to be within close quarters of somebody, if you are in a room and you're distance at 6 feet apart, that air is going to mix completely. You are going to be breathing in the other person's suspended droplets. It's just a fact of science. We can't get away from it. That's why I keep going back to the importance of wide testing nationally, contact tracing, which Chris mentioned. We need to have a vaccine developed, and we need to have pharmacological intervention, so medicine to give you when you get sick to increase your likelihood of surviving it and getting off of the symptoms as quickly as possible. It's airborne transmissible, so we have to start recognizing that, and that's going to affect our hierarchy of controls quite a bit, and we'll get into that in another slide. We've got research, and I'm not going to name all the studies because there's so much out there. And by the way, CPWR folks, having a clearinghouse for this stuff would be immensely invaluable. We know that this stuff can travel up to 27 feet. If you sneeze, if you cough, it doesn't go 6 feet. It travels quite a bit. Airborne suspension. So we've got a nice study that shows that it can be infective suspended in air up to 16 hours. So if you have somebody who is sick, they come through, they sneeze, they cough, whatever, they just talk, they breathe, right? And then they walk away. You can come in there 8 hours later and the stuff could still be floating around. Why? Well, this graphic that I got here on the left, this looks at particles settling in turbulent air. So by turbulent air, I mean your typical room environment. It could have air conditioning from HVAC, a window could be open. You could just have body heat and breathing from people, or computer systems running with their little fans. So what this is showing you is that the half-life of particles in an 8-foot high room, how long it's going to take half of them to settle out at a certain size. So we see 0.5 microns. It's going to take about 41 hours for half of them to settle out. That's a long time. 1 micron, 12 hours for half of those particles in that room to settle out. And then again, you still got half of them left in the air. Now, you can see as they get larger, they settle out quicker, and that's good news. But the viruses that we're talking about and the droplets or the small suspended liquids that we're talking about, they're between the 0.5 and the 3 microns, somewhere around there, right? And we're really concerned about the stuff that can get into our deep lungs, so we're looking at 1 micron or less. So the stuff stays around for a long time. So the social distancing thing, the thing of 6 feet, look, if you're going in there unprotected, if all you're relying on is social distancing, you might be having a false sense of security. And we need to make folks aware of this, because I've mentioned this a number of times. There are a bunch of controls that we have. And every time we select some controls, we start to reduce our risk. It might be that you have to select 3, 5, 6 controls to get that risk down to a level that's acceptable for a workforce to go back to work, or for people to go shopping back at the grocery store, or whatever it might be. And the transmission modeling that's been coming out all around the world has been very telling about what happens when somebody coughs, sneezes, or talks. In a grocery store, we've got 3D modeling that's time-oriented, where it shows what happens. We have got these clouds get dispersed from people. They get up in the room. It floats over aisle shelving, right? And it gets down to the next aisle of shelf, the next walkway aisle. So this stuff moves around, it gets around. It's definitely airborne transmissible. Why on earth the CDC is still saying it's droplet and we're using the 6-foot rule, I don't know. It's unfortunate, because it's not, it's airborne. Another thing that's unsettling is there was a recent study that found SARS-CoV-2 or the COVID-19 virus RNA on particulate matter, which is 10 microns. It's a form to designate one size range of air pollution. The next step is that we have to study to find out if the stuff that is on air pollution, if it in any way infects, increases, whatever, transmission of the virus. That's the next step, but it's troubling that this stuff is surviving on air pollution. Next slide, please. And all these things that I'm talking about, it's going to lead into, hopefully, a better understanding that you're going to have have input and decide what type and what number of controls you feel comfortable with. So I'm going to touch on the symptoms. This was already looked at in a previous presentation, but these things do evolve. Incubation period still the same, 2 to 14 days. List of symptoms, the CDC did recently expand it. There's another thing that's not up here. CDC has not put it on there yet, but they've started to look at something called COVID toe, or rashes on the feet of some people who are infected with COVID. Also, I think Chris mentioned something about stroking out. So they've found incidents of younger people having a stroke during COVID-19 infection. This is something that's got to be looked at. Again, though, the precautionary principle that was mentioned is so important because science is slow, okay? To do science properly, to do it right, to give it the information that we need, it's a slow-moving train. It doesn't happen quickly. And unfortunately, we're stuck in this pandemic and we need answers fast. So some of the stuff we might start to get an understanding of, but it's just that, it's at an understanding level, and it's not put into any official guidance or recognized by any agency yet. That's why you've seen a lot of back and forth about what kind of treatments for COVID-19 might be reasonable. There was another one that just came out where Dr. Fauci said it looks like it's promising, but the WHO then gave a statement that said, we don't have enough data on it yet. There's not enough completed studies to see if it is useful. And then there was a small study that was released, I want to say out of Italy, Spain, or Germany, that showed that it had no effect whatsoever. So, the stuff is ever evolving. The next column are really important things to understand. The percent of the population with COVID-19 who are asymptomatic has been shown to be upwards of 50%. What does this mean? You've got COVID-19, you're walking around with it, you don't have any symptoms. All those symptoms on that left-hand column, you don't have them. It doesn't mean you're not going to get them, and it doesn't mean you're not going to be really sick, but for whatever reason, you're not getting them. And I have an asterisk there because there are some incidents that we've got, some cases where large parts of the population go beyond 50% asymptomatic. The USS Theodore Roosevelt, 60% of the sailors on that ship were asymptomatic. And then something is very telling I got in the next bullet point. Testing in the Boston shelter in early April. This is the Pine Street shelter in South Boston. They looked at 397 occupants of that shelter. 146 of them tested COVID positive. Not a one had symptoms. The only screening that was done was temperature for 100.4 degrees. That's what the cutoff was, whether or not you could stay in that shelter. So imagine if you've got a work site and the only control is checking temperatures or, self-reporting of symptoms. You might be putting that work site under a false sense of security. That's why I mentioned, you might need to slap a bunch of these controls together to get to an area where you feel comfortable. Does this mean that I think we should not use temperatures? No. Look, if you can collect 5-10% of a work population or general population and rule them out as being sick, that's good. But just because you don't get any temperatures or other symptoms doesn't mean they're clear. Unfortunately, with COVID-19, absence of evidence is not evidence of absence because so many people are asymptomatic. With that said, we've got some research that shows that you can be infectious, incredibly, most likely so, in the first couple days of being infected before symptoms present. So what this means is the virus is shedding at such a rate, it's basically using up all the energy and good stuff in its cells, it's moving on, it's allowing the virus to spread quicker in the first few days of infection, even before symptoms come out. And the last bullet is unfortunate. We have been hearing a lot in the news about talking about antibody tests, letting people find out if they had it or not because they've developed antibodies, right? The reason why is, well, it might build up some immunity. So if you had it once, maybe you've built up an immunity to it and you won't get it again. Unfortunately, the WHO has stated that there is no evidence that having it once will build an immunity. That's unfortunate. So that makes us reliant more so on a, what am I looking at? More so on a vaccine for this instead of just building up immunity. Next slide, please. So I'm just going to touch on this briefly because it's one of the things that has been so prevalently talked about, the use of respirators. So recent research shows how important it is for NIOSH to approve respirators are in protecting workers from 0.3 micron aerosols. So we use 0.3 as a guidance of how efficient a filtering face piece or a respirator cartridge is, and I'll get to that in just a moment. Look, we've got the elastomeric tight-fitting half-face respirators. Many of your members might already have these if they're in, the painting trades or something where they have exposure to chemicals, so they've already been issued one of these. These are better than the throwaway, N95s. You can also, do combo cartridges with those elastomeric respirators, which is good, especially if you're doing work that might be significant disinfecting and cleaning. So I don't know if you represent at all anybody in custodial trades, but if all of a sudden you're used to using a gallon of some kind of a disinfectant and you're upping that to 10 gallons a day, right, because you're doing this at a much greater rate, you might need to be protected against that chemical if it's volatile. So then we've got the N95 disposable ones. They're disposable. They're not meant to be reusable. Next, we've got a loose-fitting, medical face masks. You can't fit test these. There's no user seal check method for these, so you can't tell if it's properly seated on your face once you get it on there. Literature shows that they're anywhere between 30 and 50% efficient at 0.3 micron aerosols. And lastly, we've got the old bandana or the scarf or whatever you want to call these things. Again, no fit test, no user seal check. Anywhere from 2 to 40% efficient is what I've seen in the literature. And I've probably reviewed about 20 or so studies on different types of filtering face pieces, including, cotton masks and things like that. Okay, next slide. So this is an issue of why that 0.3 is used. So this is a graph that looks at filter capture efficiency on the left. And as you go up on that left side, you get to 100%. And then we've got particle size in microns, which is down at the bottom. I've got from 0.1 to 10 microns down here. At 0.3 microns, we look at that because if you've got smaller particles in that, they operate like gases, okay? So when you've got solid particles of liquids in the air, and they're that tiny, they actually start to act like gases. So they move around, they have similar travel patterns, and they're going to get electrostatically diffused onto the filter capturing material. So this material that they make the respirator capturing material out of, it's actually electrostatically charged when it gets created. So if you disinfect it, if you clean it, chances are that process is going to inactivate that material to some extent. That's one of the issues that we have, and I still don't know how they're able to get some of the efficiency ratings on these filters when they're being disinfected like this. If you've got larger particles, they can't turn the corner. So imagine, taking your corner in your car too fast and you swerve off the road, right? So these things are so big as they're speeding up into your filtering face piece, they can't get around the fibers that are there, and they're going to get impacted on it, or they're just too big to fit through the tiny spaces that this material makes. That's why it's so important to use fitted N95s as a minimum. Next slide, please. So this is important to understand. Laboratories are laboratories, but real life is much more complicated, right? So under real world use, N95s might provide a lot less protection than what's designed. So experts evaluated, efficiencies back in 2003, and they found as much as 20% leakage in N95 respirators. This is a concern. And, you know, some of the issue is training. People don't know how to put it on. I mean, how many people here that are participating today have gone out shopping and saw, you know, just a general member of the public have an N95 on, but it wasn't on right? Either it's around their chin, it's not covering their nose, they didn't depress the metal bar, they're not using the straps right, what have you. So there's issues of, you know, fit testing. These things might not be fit tested right. There's not, we have a photo here of somebody performing, you know, a fitting, and then they're going to be doing a user seal check. This stuff, if it's not done properly, is going to negate the efficiency of these respirators. What's the solution? Well, one of them is, if you're still going to not do it the right way, if employers aren't going to have, you know, proper diligence and training, respiratory protection program, et cetera, maybe you got to upgrade to P100 so you can take out that 20% decrease in efficiency, so you get closer to the 95% that you thought. I don't have the answer, right? But this is just something to consider when you're fielding questions from your members, or you're thinking about how to make your training center safer. What respiratory protection do we take? Next slide, please. There's been some discussion about, you know, counterfeit. So this is just a graphic right out of NIOSH. You know, how can you tell if it's NIOSH approved? There's specific markings that are going to be on here. Manufacturer's name, NIOSH, that's spelled correctly, is going to be listed on there. You're going to have a TC approval number, a filter designation. So, you know, N95, 99, or 100, could be a P100, P99, etc. So you want to look for that respirator. You want to give clear training to folks if they're looking at it, what to look for. Next slide. This is a list that I saw on one of our outbreak listservs of labor folks from Ellie Barbarish. She put together 6 common methods of looking to understand if you've got a counterfeit N95 or a filtering face piece. You know, check to see if the manufacturer is on the FDA Appendix A, and I won't go through reading all these, but this is a nice job she did at creating this, this list of 6 options for checking. And just because you check one doesn't mean you're one and done. I would go through all of these, especially if you're looking at doing a bulk order or accepting a bulk order of respirators. It's really important to make sure that you've got a quality respirator. Next slide, please. Here's some just common clues. There's no markings on it at all, no TC number, no NIOSH markings, NIOSH is spelled incorrectly, presence of decorative fabric or other decorative add-ons. Believe it or not, we've got examples of this. Crazy claims on the box, you know, or the directions that it's good for children to use, you know, et cetera. So you want to look for things like that. Next slide, please. These are just some examples of the CDC counterfeit page. They've got dozens and dozens and dozens of actual photos of ones that they have been given to as counterfeit. So this is just a good place to go to look to see what some of these counterfeits look like. All right. NIOSH has a method to test N95 variables that may reduce their efficiency. So what do I mean by variables? If it's from an international you know, vendor, so maybe it's something that was used in Britain or in Germany or Canada or, you know, I don't know, Spain or China. If you have it stockpiled and if it's past its expiration date, is it still going to work? Well, does it get less efficient because the sizes in the respirator get bigger? No, that electrostatic charge and ability gets diminished over time. And then how about a decontamination process? So the other variable is if you've got these disposable throwaways, but you're going to try to keep them and decon them, will that process that you have make them less efficient? So you can actually give them to the NIOSH testing method, and they're going to go through and provide you with results to help figure out if you can still use that respirator under the variables that you've given to them, which is, this is good. This is a great resource. Next slide, please. So I won't belabor this, we've seen it, but I just want to point out that PPE, it's at the very bottom. And look what's at the very bottom of that triangle, cloth masks. Putting people in cloth masks, it has some efficiency, okay? We've already shown 2 to 20%, could be more. I'm sorry, but it's not the right solution, okay? I don't want to take it away from people, but it does provide some level of protection, but not the level of protection that we need to be congregated at a work site in close quarters with people. I don't want workers to get this false sense of security because their employer says, hey, everybody on here is going to wear cloth masks because that's what the CDC recommended. That's not okay. I'm also concerned that an N95 becomes the justifiable norm for all types of work on construction sites or any work site, even though you have organic vapors that you need to be protected with. We need respiratory protection programs, which are going to give us the right respiratory protection that we need. Something to consider, though, for you folks that are going to be managing training sites. I keep looking more and more at engineering as being something that we're going to have to rely on. And ICRA has already come out with some guidance there. They've got a task force that's looking at appropriate types of engineering ventilation controls. Some of these things are as basic as increasing your MERV efficiency filters up to 13 or higher. You know, this might entail a redesign of your ventilation system. You might need a fan with more horsepower. Other options are UV lighting with the air that you're going to be recirculating either in your duct or using upper air systems where you can put a UV light system at the very top of your ceiling so that it's only going to be capturing viruses that float up to the top, which they're going to do because of basic currents in the air. And there it's going to inactivate the virus. There's some other options that we have as well, but if we look back to those first couple of slides where we talked about that 6-foot rule, doesn't really mean that much. We're going to have to look at other interventions, other controls to reduce our risk until we get a vaccine. It's going to have to happen. Again, the farther you can be away from somebody, the better. All the way till you just isolate your family at your house. But if we have to go back to work, that's not an option, right? So we have to figure out how to do it safely. And I, for one, am not okay with, you know, having a broken process with workers going back to. And by that, I mean, I'm looking at the meat packers getting told they have to go back to work. The meat packing industry has a broken process for how those folks work. They work too close together. There's too many hazards. They're expected to work too quickly. They don't have sufficient staff. And now they're saying, go back to work. Well, there's no way they're going to control COVID-19 for those folks. It's just not possible unless they completely redesign the way that they're going to work. Putting up a barrier between them when you're shoulder to shoulder, that ain't going to help. So we have to really look at some of these alternative controls to make sure that we can be protected. Next slide, please. Also, a side note on that, I did see in a statement that the meatpacking union workers are saying, no, we're not going back. So good for them. COVID-19 transmission controls must be thorough to protect construction workers. So I think some of you folks might have seen this. I developed a plan at the request of you know, the IUPAT for an actual model employer program. So a program is an employer's written intent of how they are going to meet the requirements of a standard or a law or a guidance policy. In this case, we don't have a law, so a lot of this is best practices, guidance from CDC, WHO, etc. But what I did is when I put this together, I put it together as if I was running the site, what are the best practices? I've got an option in there for a COVID-19 officer to basically say N95s for everybody at the site. To me, that's not a big ask. If you want your workers going back to work, to get the job rolling again, get the economy to rolling again, don't put them back with minimal controls where they have a high risk. So this plan covers a bunch of different controls, including some things that you might not consider a control, such as a worker sick policy. Unless workers have an understanding and a guarantee that if they are sick and they can say, hey, I'm sick, I can't come to work, okay, no problem. Get yourself well, stay home, contact your medical health professional, 14 days, see you later. You're going to get paid for all 14 days. Unless that is guaranteed, you know you're going to have workers that are going to show up, you know, with potential symptoms and try to work because they have to. So part of the control is to have a good, sound sick work policy. Part of the control is to have a responsible COVID-19 site officer that is responsible and has authority to make changes. Part of the control is to make sure you have an employer, a job owner, a general contractor, fund the controls and give the resources necessary to make all those controls an option. What does that mean? Well, we can't get mobile wash stations here. To me, that's not an option. You've got to give resources to make this work. Otherwise, you're just asking workers to come back into an environment and they will get sick. How do I know that? Because we have over 1 million cases of people sick in all walks of life right now, right? So the evidence is there. Again, there's a combination of controls here. I'm not saying any one of these is the right answer. You might have to select a number of them to get that risk down as low as possible, where you feel comfortable as a worker, as a local union, as an international union, so that you feel comfortable for the members to go back with a little risk, preferably no risk. But being a realist, if you go out of your house right now, there is a risk of getting COVID-19, even if you take a number of precautions. And these programs must be work environment specific, okay? So this is a good model plan, but it's gotta be adjusted depending upon the type of work you're doing. And it might have to be adjusted for the type of construction work you're doing. Again, if you are on a construction site that is completely wide open and you're getting 5 to 15 mile an hour winds blowing through every day, your risk of getting this is going to be lower because you got damn good ventilation. But if you're at the end game and you're taping inside a building, you're putting the final coats of paint on, you're putting the carpet down, your risk is going to be higher because that air is going to be stagnant and it's going to be in a closed quarters where you've got congregation of workers. So it's got to be work environment specific. Next slide, please. And we're coming to the end of our program here. Current state of COVID-19 construction site paints a very chaotic picture concerning standardized worker protection. I'm not going to go through all these. You'll have them when the slideshow. There are so many examples of different states, different counties, even differences between Canada and the US about how construction workers are being protected. Some have really good plans. I can point to Massachusetts and Washington. Others have no plan whatsoever, crossing your fingers and hoping that it's going to be mercifully disappear. And then you've got a number of cases where people have had to walk off the job. Local unions have shut down work over concern and everything in between. So there's a very chaotic picture out there right now. And again, I like to say that a silver lining in this is a union moment for not just the IUPAT, but all labor together to stand up and say, hey, this is how we have to do this going forward so we can be unified. Not letting states fend for themselves and have a battle royale and seeing whose workers are going to get sick first. Not appropriate. At least that's not in my industrial hygiene code of ethics. I haven't learned that. So next slide, please. Just some guidance up there if you're operating a training center. So you've got to have a COVID-19 training center plan. And you can later increase this to look at all different types of potential disasters that might happen at your training center. But right now we're looking at getting students, getting butts back in the seats in your training centers, because we do know there's some learning that can only take place face-to-face, hands-on with an instructor. The American Industrial Hygiene Association, which I'm a member of, they created a nice guidance document for what's going to happen when you close your building down. You have to consider what happens when you open it back up. Buildings are living, breathing institutions. They were designed with a certain occupancy load of people being in them. So it's not good to shut all your systems down. It's not good not to control relative humidity. Mold can grow. It's not good to have stagnant water at low temperatures. Legionella can be developing. So there's a number of issues that you might want to consider about your building right now with nobody in it. And again, I'd be happy to answer folks' questions offline and things like that about giving some guidance. And ASHRA, again, You know, the heating and ventilation engineering experts are right now in a task force trying to develop what the best practices are for operating a ventilation system to reduce risk of COVID-19 transmission. And I'm keeping an eye out for that. And I think we're at our final slide after this. The IFTI has developed and continues to develop some COVID-19 specific resources, worker and contractor fact sheets that model employer COVID-19 plan. And I just want to say that's a model employer COVID-19 plan which they have to own. The IUPAT, any labor union, it's not their responsibility to develop an employer required plan. That's the employer's job to do that. Unfortunately, call me pessimistic, but I have little faith that it's going to be done well right now, just based on the fact a lot of them don't have other programs that they should have had. So this is a model program that they can have as a local union. You can bargain with them to make as much of that plan happen as possible. COVID-19 training on LMS, there's a number of things that have been going up over the past couple of weeks that are related that you can access on your learning management system. ICRA awareness that Ken has already talked to, both awareness and worker courses. And finally, and I'll just mention this in passing, and if Anton and Tom or anybody else on the team wants to speak to it, we've been working at a COVID-19 campus plan for opening the headquarters site up in Maryland to get a return to hands-on training and face-to-face training. With that said, I'm thirsty. I think I need a drink. Might be something a little stronger than my seltzer water here. So hopefully nobody has fallen asleep during this, and I'd be happy to answer any questions.
Hey, Bernie, we got a question from Jeremy Allen. And so if you have a half-face elastomeric on and you're wearing it, you get a lot of stuff that comes out of the exhalation valve. You sweat inside your mask and all that stuff. You got a lot of stuff that goes outside the exhalation valve. How is that protecting others? What can be done to minimize that risk?
Good question. So wearing that tight-fitting elastomeric respirator protects you as the worker. You are going to be breathing out. So if you are COVID positive and you don't know it, you're breathing it out. But what does protect the other workers around you is if they have an appropriate tight-fitting elastomeric respirator on as well, or at least an N95. That's going to protect them. The issue with the cloth masks and the medical face masks, the research on this is actually been quite telling about how much of it actually gets out if you cough or sneeze. But it's designed to sort of capture as much of the stuff coming out of you as possible. But a lot of stuff still makes its way past that membrane. So your elastomeric respirator is far superior, and it's designed to protect you, not other workers. Good question.
Could open it up to questions. Anybody got questions for Bernie or anybody that's was talking?
So Bernie, I just got a comment. Phenomenal presentation. We talked to Bernie probably a couple times a day. Get updates on all the new information as it comes out. And like Bernie said in his last slide, we're working to put together a plan for how we open the office back up here, how we open the training center, what that future is going to look like for us, what changes need to be made. And we're looking at it from a couple of different standpoints. One of them is related to COVID. What do we need to do right now? How long does the office need to stay closed? When we start immediately recovering, what does that look like? But then we're also talking about that health and safety culture moving forward. What does it look like a year from now? What's the new normal for us? Because things are going to change. The way we go about doing our business, both in the office and in the training center environment, are going to change. So we're working on putting those pieces together, and they'll come out as not just what we're doing here, but as recommendations back to you all as DOTs. We'll be looking for some input from you all once we get a little farther down that road and get a little bit closer to implementing some of these things. We're going to talk about what we're doing, and then have you take a look at it and say, yeah, we like that. No, we don't like that. This will work. This won't work. Here's what's different for our environment, so that we can make some recommendations back to everybody And just like that site plan, they're recommendations. You know, you have to modify it for your specific environment, just like a contractor has to have a plan on their specific job site. So we're going to do the best that we can. We've got, you know, Bernie's brilliant. I think anybody that has heard some of his presentations, saw the webinar, you know, that he did, was at the town hall meeting or attended the town hall on Facebook and YouTube. You know, Bernie really knows his stuff, and we're so thrilled to have him. He's a great resource, and you can see his passion and how much he really cares about our members, you know, and the union. He really said it when he said we have to stand up as a labor movement. You know, you heard Chris and Gary both mentioned it, Ken's mentioned it, Bernie's mentioned it. We've all kind of talked about it. I'm not joking when I brought up the in the chat, the UV, you know, getting UV into the body and drinking disinfectant. I mean, that's the kind of stuff that is being kicked around by people. It's disgusting that that's the culture, you know, here in this country, and the way that workers are abused and mistreated, and the way that they're looked down on, and everybody looks for the bare minimum. You know, somebody said that earlier regarding OSHA, it's the bare minimum standards. We need to uphold not just the bare minimum, we need to take it that one step farther, and that's going to include our training centers, that includes our job sites. I was on a conference call earlier with vice presidents and department heads, GP, GST, and one of the things that they brought up was collective bargaining. And you know, there's contracts that are expiring in May. There's new collective bargaining that needs to happen, and health and safety is one of those things that we need to push. OSHA right now is not requiring N95s on the job. There's no regulation that exists. You heard Chris say that, Bernie say that. But if we can collectively bargain health and safety into our contracts, if we can, and the VPs are going to be talking with your business managers about that, if we can bargain that stuff into the contracts to where the contractors understand what their responsibilities are, what they should provide, that goes over and above, you know, the poor recommendations that are made by OSHA, made by the CDC right now. We need to protect our workforce. We need to protect our members. Our contractors want it too, and they need tools to push back on the GCs. You know, it's all of us together standing up for labor, standing up for our members. You know, and we're going to have to do it because, you know, no one else is looking out for them. So, Ken, I'll flip it back to you for Q&A. But, you know, great presentation, Bernie. Thank you.
I just want to add a little bit, and so everybody's aware that keep an eye on the LMS. The curriculum department is working diligently, overtime, all hours of the night, making sure that the information Bernie has, the information that we're hearing from all the research that's being done, you know, as it's coming and it's important for the affiliates, we're getting it onto the system. So there's new stuff being added. There's new courses being added through the LMS. So just make sure that you're keeping an eye on that and sharing that with your members.
And Ken, on the websites, the IUPAT has a COVID site that links back to CPWR, that links back to FTI sites, that links back to the LMS. The LMS links back to IUPAT. You can go to any of our websites and get access to all these resources across the board, including Take Me Back to CPWR for their guidance. So, you know, make yourself informed. We need training, and we need to keep people informed. Somebody said it earlier, Bernie, maybe it was you, we're talking about walking around the grocery store and seeing people with their masks under their nose, improperly wearing masks. I mean, I see it everywhere. I saw some people, you know, screwing around at the gas station this morning, you know, and people, you know, they're just not thinking. Part of it is just a disregard for not just their safety, but other people's safety. Again, in the chat, I saw Al was putting a class on. Somebody didn't want to put their, you know, the required PPE on, and he sent them home. That's the kind of stuff that we need to do. We need to support that safety culture, make sure that people are adhering to it. And part of that is training, getting the word out, making sure that everybody understands, you know, all this stuff that we're talking about, why it's so important, you know, everything from wearing PPE, wearing it properly, disinfecting it, you know, how we're going to combat this and what the new normal looks like. It's going to require a heck of a lot of training and discussion and making people aware of, you know, what we need to do and how we need to do it.
It's opening up for discussions from the group that's out there. You got any questions for any one of us on what's going on and, you know, what our thought processes are?
I just wanted to say that was a hell of a presentation. I think we're pretty much on our game up here in Canada. We've done a pretty good job so far, but even I found out and learned a few things today that I wasn't aware of, and especially about the fact about this virus being able to become like an aerosol and travel a lot farther than was originally anticipated. So great presentation. Thanks.
Thanks, Patty. That was that's good comments. Any other comments out there? Any from the group? I would like to add the fact that, you know, we're all a team. We are all IUPAT brothers and sisters out there. I know we hear this constantly, but more today than ever. We really need to come together as a group across all of our regions, Canada, across East, Central, and West, and really work together for this pandemic and the future and what the future looks like. There's a lot of ideas out there. There's a lot of things that we are all trying and doing, from our Zoom meetings to our webinar meetings to how we're going to open up our training centers. And I think that we really need to share that information. I know that the curriculum department has opened up the instructor lounge. It's up on the website. So I would suggest using that as one route of sharing the things that you're doing. But I really truly feel that this is a time we all need to be working together and really coming out with a solid plan and helping each other through all this stuff.
Hey, Ken.
Yeah.
Great job, you and Bernie, putting this together. And as you're tailoring this more towards the IUPAT, will this eventually be translated into French and Spanish, or will this just stay in the English version of this program here now?
I can tell you, Dan, we are definitely talking about that. I know some of the videos that are the short videos that we've put up, it's been translated into Spanish. You know, so some of the videos are already being translated into Spanish. We are talking with Simon and getting it translated to some French on some of the videos. I can't say that everything will, but I can tell you that we are in talks and we are working on making sure that we are reaching all the population of our members and not just one side of our members.
Very good. Thank you. I know some of the DOTs have asked about it. As this course is being really put together for the IUPAT, I think you satisfied their questions that have come up. Thank you.
Yeah, and I would reach out to everybody that's on the phone. If you're seeing this material, you know, when we get it translated, if we have a translator or something, it gets mixed up. We really need those people that understand what's going on, understand what we're talking about. If you can help out, if you want to help out, you want to help translate some of the stuff that we're doing, I would suggest to reach out to us and let us know. Any other questions? Anton?
Okay, if there's nothing else, you know, again, I really appreciate everybody getting on. Like I said yesterday, I really wish we could be in person. I enjoy seeing y'all and talking with y'all. I get a lot out of it, but I think this has been, again, really good, really effective. It was a really good use of time, and it didn't require us getting on a plane and you're putting ourselves at risk. So thanks for being on. We got one more session tomorrow. I'm looking forward to that one. Looking forward to seeing everybody again. You know, I can't say enough. You know, I appreciate you all, the hard work that you're doing every day. You know, I understand the tough situation that we're all in. You know, as we're trying to figure this stuff out and just kind of work through everything. So thanks for taking the time out of what I know is a crazy busy schedule, you know, and being here with us. We'll see you tomorrow, and if you think anything through over the evening, just have it ready for tomorrow. We can talk about this. We can talk about Helping Hand again. We can talk about any other thoughts that you have, discuss anything you want to. So thank you all so much, and have a good rest of your day, and stay safe.
Thank you.
Thanks, everyone.
Thank you.
Thanks, guys.
Thank you.